Right now, our country is experiencing something that has never happened in modern times, and that has created a tremendous amount of community anxiety. To make matters worse, we are living in a time where information is coming at us at breakneck speed via social media, making it hard to separate fact from fiction. Well, we're talking facts that could make a difference between life and death. And now there is help. Dr. Catherine Fiedler is the Vice President of Population Health at PRMC and joins me this afternoon. Thank you for being here with us.
Thank you so much for having me.
Yeah, it's been a crazy, I'm sure it's been a crazy week for you.
It has. We've done a lot of things. You know, Peninsula as a health system does disaster planning as part of our normal course of operations, but as you said, this is different. So we've done a lot of things in 1 week that have been very amazing. Number one is we have reduced our visitor policy. We now, as of today, have a no visitor policy at Peninsula, and that's very important to maintain the safety of our patients and our staff. There are some circumstances, labor and delivery, pediatrics and things, but it is really no visitor policy, not one, no visitor policy. We have an ED screening tent all set up. By Tuesday it was set up and functioning on Wednesday, so we could screen every individual before they came into the hospital, risking potential exposure. We have a mobile 20-bed hospital set up in our parking lot, so it is all ready to go should we need that for the emergency department or our inpatient. We are mobilizing our entire team. They are incredible.
Yeah.
I get tears even thinking about the things that we've been able to accomplish in a week, and everyone wants to help. We have an amazing healthcare team and amazing community. And then the last thing is the triage line that we wanted to talk about today.
Yeah, and that is a partnership between the PRMC and the Wicomico County Health Department?
It is. This is time for teams to come together in very different ways, and we know our public health experts with the Wicomico County and our other health departments are key for this. So what we did was establish a joint call line. It's staffed by nurses and care team staff from both organizations. It's housed at Peninsula, knowing that that way we can get the real-time information to folks as we need it. It is staffed from 8 to 6. 7 days a week.
Yeah, so who or what kind of questions are you taking from people?
So I think people have a lot of questions. What we'd like to do first is just direct people to the amazing websites that we have. I know peninsula.org and the Wicomico County Health Department both provide all the current information from the CDC and the state. And then we also have information on if I have symptoms. So when you get to that point and you're worried, you can call, you can talk to a nurse about your symptoms and what you should do.
And say, you know, during that conversation, the healthcare provider sees that it could be a possible case. What's the next step? What's the process?
So it's important for people to understand that, especially in allergy season, you know, we're really looking, do you have all these symptoms? Do you have shortness of breath? Do you have itchy sneezes? Do you have coughs? Do you have all those typical cold symptoms, but also a fever? And have you been in close contact with someone else with COVID-19? So that's where we start to determine whether or not you need to be screened. We then recommend that you call your provider. Providers are doing a wonderful job in our community answering some of these questions, and should they need to refer you to the emergency department, then they would then send you there and you would be screened again.
Yeah, because it's a really scary time, and when you get those symptoms, it gets even scarier. So what advice would you give to people who may be, I guess, freaking out because...
So I think the first thing is most of us will just experience average or no symptoms from this. So we will just get a cold, we might get a low-grade fever, and typically those are the times we stay home. This is the time you need to stay home. Call your provider if you have any serious questions, but stay home. You know, this social distancing that's going on is hugely important to bending that curve of disease and maintaining our ability to take care of the patients who do get very sick in our community. And that's what we want to do. So if you're feeling just poorly, please stay home. Wash your hands, don't touch your face. Tylenol and Motrin have always helped for me for cold and flu symptoms. So those are the kind of things, that typical advice that your mother always gave you. That's what we need to do, but stay home. Don't expose yourself to somebody else.
Sure, sure. All right, so it's a triage line, and we have all the information here. The number?
Great. It's what, 410-912-6889. I've been memorizing that number for a couple days, and it's amazing. It came together through the amazing work of our telephone operators, our nurses, the staff at the health department, and just to build something like this in 2 days was pretty impressive. So it's exciting to see what we're able to do.
All right, Dr. Catherine Fiedler with PRMC, thank you so much, and thank you for
so much.
everything that PRMC is doing for our community.
Thank you.